the videos what I have been taking up in obstetrics and gynecology. Today's topic of the discussion is about the best sleeping positions during different trimesters of pregnancy. So it has been mostly seen that during, it's a very common question because the pregnant women who are expecting, basically during their earlier times when they were not pregnant, or during their times when they were not conceiving, actually what they used to sleep, they used to get a very sound sleep. But once pregnancy sets in, once pregnancy occurs, it becomes very difficult for them to sleep in a comfortable position, just because of the so many changes, so many physical, physiological, as well as the bodily changes, the hormonal changes are there, and these are going to give rise to myriads of symptoms. So these myriads of symptoms can include the morning sickness, the frequent urination during sleep, the leg cramps, and the lower back aches are there. Apart from this, due to certain hormonal imbalances, they might experience certain nightmares, and they actually see more frequent and vivid dreams. And apart from this, there can be congestion and snoring. So actually, during all, because of all these factors, there has been found that there is an increased tiredness because of the lack of sleep. So these expecting women, they tend to wake up more often during the night time. At times they need to go for frequent urination, they can get even vivid bad dreams, they can dream vividly. So there are so many factors which are contributing to that, impairs the pregnant woman from having a good and a sound sleep. And this has been shown in researches that for a pregnant woman, they require more sleep as compared to a woman who is not pregnant. The pregnant woman requires more sleep and more sound sleep for the proper optimal growth and development of the fetus. So they require a good and ample amount of sleep. So actually the sleeping position is of a great concern, because it has been found that just because of the physiological changes, the protruding belly, it becomes very difficult for the expecting mother to sleep comfortably. So what it is mostly advised is that once it is your first trimester of pregnancy, mostly you can sleep in any position. You can lie in the supine position, with lying on your back. You can lie on your lateral positions, that is the right and the left lateral positions, or you can sleep with in any of the posture apart from this. So during the first trimester, it is safe to sleep in any of the positions because the fetus has not grown that much. But during the second and the third trimester, mostly it is seen, since as the baby is development is slowly and gradually proceeding, and the baby's size is increasing by 26th week of gestation, it has been found that the baby approximately is now more or less having a weight of 1 kg. So at that particular time, just because of the protruding belly, it becomes very difficult for the expecting mother to sleep comfortably. So in that particular situations of second and third trimester, and particularly after 28 weeks of gestation, after completion of 28 weeks of pregnancy, it is mostly advised that the expecting mothers should sleep in either of the lateral positions, whether it be the right lateral positions or the left lateral positions, and most preferably in the left lateral position they should sleep. Now, one question very importantly arises, that why during the second and third trimester, the supine position, that is once the pregnant woman is going to lie on the back, is prohibited, is not allowed to sleep on the back or in the supine position. This is because once the expecting mother is going to lie with back on the bed, that is ultimately going to cause an obstruction or a decreased blood flow in the major blood vessels, which is going to supply blood to the uterus. And ultimately, we all are very well aware that the developing fetus, the developing embryo, is going to derive all its nutrition and nutrients. Apart from this, the oxygen supply, it is going to receive through the blood. So once the uterus is being impaired of getting a proper blood supply, so that can have adverse effects on the developing fetus as well. The growth of the fetus will be restricted, just because if their oxygen is not in the adequate supply. So ultimately, oxygen is also required for the proper functioning of the embryos or the fetus's heart. So actually, once the expecting mother is going to lie on the supine position, that is going to cause an extra pressure on the major blood vessels, that is the aorta. So ultimately, this is going to cause a decreased blood supply to the uterus, and ultimately if there is a decrease in the blood supply, there is an oxygen deficit as well. And if oxygen deficit is there, ultimately there can occur certain kinds of the fetus heart rate can also be affected just because of this. So the heart rate is also going to be affected if a proper positioning of the expecting mother is not there during sleep. So basically, it has been found in researches that once the oxygen supply of the or if the blood supply to the growing developing fetus is being impaired, so this becomes one of the very important causes for stillbirths. So stillbirths can have very multiple number of causes, but one of the contributing factor for stillbirth is that the sleeping posture or the sleeping position of the expecting mother. So it is mostly preferably advised to the expecting mothers that they should sleep on the left lateral position, and this left lateral position is going to reduce the chances of stillbirth approximately to half. So which side you should sleep? Actually, this is a very common question. So basically, doctors advise that you can sleep in either of the side positions, but preferably you should try to sleep on the left side, whether you are going to take a full night sleep or whether you are going to lie on the couch or on the sofa set for a short nap or something. But you should try to sleep on the left side, preferably, or either of the sides, but not lying on the back after 28 weeks of gestation. Apart from this, it has been mostly seen that to make the sleep more comfortable, the expecting mothers, they can put a pillow within their knees, and they should flex their knees while sleeping in the side position. They should little bit flex their knees and with a pillow placed in between the knees. Apart from this, if the belly protrusion is too much and if the belly is protruding, they need support for it, so even they can place a pillow in the support of their belly. Apart from this, it is mostly seen that during the times of sleep, most of the expecting mothers, they do forget, they twist and turn during sleeping. So ultimately, suddenly when they wake up, they find that they are sleeping in a rock posture. So to avoid this, they can even take the support of a pillow to be lying at the back of their at the back, and in the hip region, they should, at the back side of them, they should also keep a pillow, so that will prevent them unnecessary twisting and turning while during pregnancy. So these are the this was a very important questions, and this is a very important query what the most of the expecting mothers think, that in what trimesters how to sleep. During the first trimester, you can sleep in either of the, in whatever posture you feel like, but after the second trimester, that is from 28 weeks of gestation, from 28 weeks of pregnancy, it is mostly preferable to sleep on either of the sides, most preferably on the left side. That is, the left lateral position is the best position, for the ideal position for the expecting pregnant lady, which is advised by the doctors. If you still have any queries or comments, you're most welcome to comment me in the comment section. And viewers who are new to my channel, who haven't subscribed, if you like this video, give this video a thumbs up. And if you are new to my channel, subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.